Hi, everyone. This is Sean with the MassSupport Network here with your Massachusetts Weekly Public Health Report for Friday, February 26, 2021. So estimated circulating cases continue to trend downwards, not quite as much as they have in previous weeks. There's a possibility that things are leveling off at the moment, but it is still a reduction. In terms of people undergoing a quarantine for suspected cases or exposure, we were at 13,000 last week. This week we're down to just 10,000. That's still a significant reduction there. We'd like to see that much lower. In terms of people under isolation, which is people with confirmed cases, we were just under 40,000 last week, and now we're just above 33,000. Let's continue to trend downwards there. The average age of hospitalizations and the average age of death have each gone down 1 year. And we should actually kind of expect to see this as the elderly population is the first vaccinated. That means that we will likely see fewer deaths in that group, and that may skew the numbers lower. In terms of hospital usage, we are seeing a lot less this week. We are less than 1,000 people in hospitals for COVID-19 for the first time in many months, and also trends downward in people in the ICU and on ventilators. Positive progress there. One huge jump has been the turnaround on testing, going from 1.76 days on average to 1.36. That's over 12 hours faster. So that is a great speed up there. That may also be, though, the fact that when fewer people are getting tested, then we have less backlogs in the labs. Now, that said, if fewer people are tested because fewer people are having exposures, because there's fewer circulating cases, that will also help with it. And as the number gets lower, that makes contact tracing as well much easier. Speaking of which, mostly holding about steady in terms of contact tracing, a little bit down in terms of number of total outreach completed, but more contacts reached, and things are generally being done within a day as well. So as the testing gets faster and the contact tracing gets faster, it becomes much easier to isolate any individual new cases before there can be any spread. Looking at the state as a whole, various counties, the average daily incidence rate per 100,000 people over the last 2 weeks was 30 cases last week. Now it's down to 23.3, and just kind of a steady decline across the state. No one's taking upwards. The highest transmission rate county right now is still Hampshire County, by population, of course, as a result of the tail end of that outbreak at UMass Amherst, followed then by Hampden County. But the eastern part of the state has gone down a lot farther, which is very promising because those are also the most populous areas where you'd expect the most spread. In terms of the percent of tests coming back positive, that's continuing to decline with just under 2% positive tests right now, or 3.1% if we remove the screening tests done at higher education facilities, which tend to skew the numbers lower. Looking at the 7-day average of new cases across the state since the beginning of the year, you can see there's been a general trend downward that appears to be more or less leveling off the last couple of days here. So let's keep an eye on that to make sure that's just a temporary plateau. We head downwards again soon and not about to tick back upwards again. Looking at the transmission rates by county, these are the ones with the higher rates. Of course, these are also generally the more populous counties, so we expect more raw numbers there. You can see a pretty steady decline across them here, with more or less even rates of decline across all the counties. And again, many of them do have either a slight uptick or a plateau the last couple of days here. A month with Middlesex having a pretty steep decline just this month, but then again leveling off here. When we look at the lower transmission counties, just the smaller ones, we see again some decrease, some that are already pretty low and staying around where they were, like Franklin and the Islands, Berkshire County coming down a little bit, Barnstable having a significant drop there, and of course Hampshire experiencing that uptick from the UMass outbreak and then trending down again afterwards. All right, and one last thought as we go into the weekend. This was just a little comic that resonated with me, and I'm sure will resonate with other people living and working in the pandemic. Dinosaur Cycle says, too anxious to sleep because of all the work I have to do, and too tired to work because I didn't sleep, and the cycle continues. For more from the MassSupport Network, you can find us on our website or on social media. Remember, wear your mask, wash your hands, and we'll be there if you need us. Stay safe.